SPARSH Group of Hospitals has partnered with MGM Healthcare, Chennai, a leading quaternary care super specialty hospital in Chennai, to establish a heart and lung failure management and transplant program in Bengaluru. As a part of the initiative, SPARSH, in association with MGM Healthcare, will offer a comprehensive transplant program covering heart and lung transplants. An estimated 5 lakh Indians die each year waiting for organ transplants. A report by NOTIO National Organ and Tissue Transplant Organization suggests that close to 50,000 people suffer from heart failure in India each year, yet only 10 to 15 heart transplants are undertaken annually. The deceased organ donation rate in India at less than 1% per million population is a major handicap and translates to less than 1 person per million opting to donate their organs. Superstitions and stigma, lack of transplant coordinators, and lack of required infrastructure for certifying and maintaining brain-dead patients are the reasons behind the low donation numbers in India. While the lack of organ donation is one side of the story, another aspect is the absence of required processes, qualified professionals, and necessary hospital infrastructure facilities.
We saw an urgent need in the number of organs that are being wasted. To mitigate that, we thought we'll partner with a large institution like MGM Healthcare in the space of heart and lung transplant. So we have a large institute dedicated in RR Nagar for multi-organ transplants. And part of that is lung and heart transplant. So we thought to scale up the numbers in Karnataka and to benefit the people of Karnataka, we thought we can partner with this MGM Chennai-based hospital to improve and scale up the volumes of heart and lung transplants for the people of Karnataka.
So I am Dr. Ashwin Kumar, a senior consultant cardiac surgeon at SPARSH Hospitals. There are many patients who are waiting for heart transplant and lung transplant. The waiting list is further growing, and most of these patients, if the heart transplant is not done or lung transplant is not done, they will be on the artificial heart or the ECMO machines. And this cannot be kept for a longer duration of time, and we have to find a donor as soon as possible, and the donors may not be distributed equally throughout the country. Sometimes patient may be donor may be in Karnataka, but the recipient will be in Delhi, or recipient will be in Karnataka, or the donor will be in somewhere in Andhra Pradesh. So many donors, many organs are getting wasted. To prevent this wasting of these organs, where the donors are giving the organs but there are no recipients, we need to have multiple super specialty tertiary quaternary care centers like SPARSH Hospital in RR Nagar. Recently, yesterday, they did one liver transplant. Something like that, where we can have a collaboration with other bigger hospitals like MGM Hospital, and then in the partnership, we can give the best of the benefit to the patients of Karnataka. Yes, the green corridor awareness. Yes, green corridor awareness is there. At the same time, between the two cities, where the cities are away from Karnataka, I mean to say in the different states, like in Tamil Nadu or in Andhra Pradesh, wherein we can have, without disturbing the normal traffic, we can have these drones, where the drones will have, they can carry 10 to 12 kgs of weight, where the organs can be transported from the drones from different cities, which will be much cheaper than having a chartered plane or an air ambulance. No, it's a futuristic idea. It is developing. Definitely in the near future, near future, it is going to come to India.
One thing I want to tell, once the heart is removed from the donor, it has to be transplanted within 4 hours. So if you don't transplant within 4 hours, that heart may go waste. That's why we need to have transplant centers in various parts of the country. For example, other day, there was a heart in Udupi. We have a lot of patients who are waiting for heart transplant. But to get the heart from Udupi to Chennai within 4 hours, it's not possible. So if you have a center in Bangalore and some patients are here, it is easy for us to get the heart from Udupi to Bangalore. Then you can do the transplant.
Can you tell me something about in southern states?
Yeah.
How many facilities is there in different states?
Yeah. See, if you see today, centers who are seriously doing heart and lung transplants are very, very less. We are doing around 100 transplants per year. But other center, they are not even doing 20, 30. So there are centers who are doing 5 to 10. There may be around 10 centers like that. So, no, southern states around 4, 5 centers. Yeah. All over India, maybe 10 to 15. Yeah, very less. But nobody is doing it in a big way. That is because we need to have a dedicated team. But majority of the centers, they will be doing bypass surgery and various congenital heart disease surgery. So transplant is a part-time for them. If there is a heart, they will do, otherwise not. Whereas our center, it is mainly, we are doing only heart failure transplant, we are heart lung transplant, then artificial heart implantation. So ours is mainly that one. We don't look at other cardiac surgeries. So, yeah.